see, let's see if this works. Dr. Georgina is planning to join me, but we're going to give it a minute, and then if not, if it's not working, then I'll code it on. Ah, there we go. Hello.
I'm doing this on my phone, so it just wouldn't work on the computer.
Oh, really?
So,
okay. Yes. No, I think you must be on your phone. But anyway, welcome. Let me just set myself up here. So I'm very excited to have a special guest with me today, Dr. Georgina Conway, the thyroid specialist GP, a fellow Hashimoto's patient, and the founder of the Thyroid Clinic. So hello and welcome.
Hi, thanks all. Sorry about the delay, as always. It's technology that lets me down, nothing else.
Yeah, that's the problem, for all of us. So maybe we can start by you telling us a little bit about your practice and what you do.
Yeah, so I fully opened the Thyroid Clinic, as it is originally named, back in October 2020. So that's nearly 18 months ago now.
Yeah.
It happened sort of quite organically, I suppose. My journey started with my own diagnosis of Hashimoto's back when I was about 3 years post-natal with my daughter. So I guess that's about 6-7 years ago now. And I had sort of the age-old symptoms that I see people come with day in, day out, of just feeling more tired than usual, not really feeling quite myself, couldn't lose my baby weight like I had done with the other 2 kids. And that sort of, that fatigue, which I'm sure so many people know, of just, it's a fatigue like no other. It's not just a tiredness, it's a it's a hit the wall tiredness. I can't actually physically go on anymore. So I went to see GPs. I'm a GP by trade myself. Struggled a bit, was basically told I was tired. I had 3 kids, what do I expect? And that started me on my own journey of finding out myself and what was going on. And I had private bloods taken, and lo and behold, there was my Hashimoto's. Persuaded my GP to get me on levothyroxine, and just never really felt good on it. So I started to do my own research into this, and then started to use what I was learning on my GP patients. And to my surprise, sort of saw so many small but amazing changes in people. Like a lady who had not been able to get pregnant and was about to have a full-on investigative laparoscopy, suddenly got pregnant. All sorts of changes, and so it snowballs, doesn't it? You then start learn more. I was working in private practice for part of my portfolio career, and I had a lot of Americans. They were all on NDT, so that then sparked interest in all of that. And research just kind of took over my head and my patients. Then obviously lockdown hit, COVID hit, and my private practice, private GP practice closed. But my thyroid patients, of which I didn't have very many at the time, but my thyroid patients wanted me to carry on. And
because you're needed, you're so needed.
Yes, because I'm so needed. Exactly. So they were contacting me throughout, and then sort of October at the time, I just thought, oh well, let's see what happens. Never quite expecting it to go as it has. So I started with maybe 18-20 patients. I was just looking before I came online. I've now on my books got about 470, so it's just gone quite crazy.
And it is, like I said, it's just so needed, because there's a lot of frustration. So I wanted to ask you, why do you think that is? But basically, in obviously the people I speak to, my clients in the community here, there is a lot of frustration when it comes to obviously with the advice that people receive at, when they go and see their GP, their primary health doctor, and it seems to be completely disregarded. Hashimoto's non-issue, you know the drill. And like it baffles the mind a little bit because there is solid research behind it. So it's not just some sort of alternative, this might work. It works. So why, in your opinion, because obviously you come from that background, why is it that there is such a lack of, care really when it comes to thyroid?
So I think it's, so I have 3 jobs, but 2 main jobs. The thyroid clinic, and then I'm an acute medic, so a consultant equivalent in hospital, in Southmead Hospital. And I love the fact that I have those 2 complete polar opposite jobs. So, with thyroid, I feel like we're optimizing everything. Well, we're listening, I'm optimizing, I'm managing the chronic disease day in, day out. With my acute medicine, what you want to do is, I see those patients, I want to go, okay, have you had a heart attack? Have you had a stroke? Have you had a lung clot? No, fine, off you go. So it's about managing, it's firefighting.
Yeah.
Unfortunately, I think the way the NHS is going, and we could go into all sorts of political things about that, which I'm clearly not going to here. But I think that the reality is that the NHS just can't manage it. It can't. It is just about managing to firefight well, let alone manage these very chronic, difficult diseses. Yeah, I mean, I'm on Instagram Live, so I need to be. I need to. Of
course, no, just just how you see it.
That's one of the things. I think also it's a female disease, and I think unfortunately that's been very under researched throughout medicine.
Yeah, and obviously there is cost involved, like testing Hashimoto state. Like it's still what I see is some GPs are willing now to test for antibodies. I've had a which surprised me actually. So I can personally see that, and I can see also how managing that chronic condition for most GPs is just like impossible, and probably they haven't had the training, right? So it's really not their fault that they can't provide that information.
No, and we learn so little about the thyroid. Learn more about hyperthyroid because it's back to the firefighting, isn't it? It can make you severely, acutely unwell. Hypothyroid makes you chronically dreadful.
Yes, we both know. As do all of the people watching. So what do people come to see you with? So obviously, any sorts of thyroid disorders, I presume, but if you can go into a little bit more detail, and maybe also when is the time to do that? So, when is the time when someone should go?
So I would say I have probably 3 different types of patients in the whole. I have my patients who are unsure if they have a thyroid issue. To take my in a second. Sorry guys, if I don't take it now I'll forget. So there's the patients who don't know if they've got a thyroid disorder, or feel they have got a thyroid disorder and struggling to get it treated via the NHS. I then have the patients who've been on levothyroxine for 10 plus years, who've never felt good on it, and want to know if there's alternatives, want to consider T3, NDT, supplementation, diet, all of those things that they can do to make their thyroid as optimal as possible. And then I have the post thyroid cancer, post hyperthyroid, who are wanting more and often need more again than the levothyroxine that they get. So those are the main, and actually as I've developed with the thyroid, I've also sort of ended up doing an awful lot of HRT because the 2 are completely combined. And
so that's something I think maybe we can even do like a separate chat on that, because I just realized that today probably won't have time to go into that, because that's such a big subject. But yeah, a lot of ladies that I speak to are also interested in that and the link between the two. Okay, so that's so when is it? So would you say, because I've just seen a comment someone saying that not everyone can afford a private GP, right? So what would you say someone can do, how they can speak to their GP to perhaps run some tests? Do you have any words of advice for them for people who can't afford the
private GPs? Yeah, and you know, I'm so aware of my costs always. It's not where I ever imagined myself being within private. I'm very NHS minded, so it is something that I'm very aware of. Whoever commented that, and what was your question? So what I would ask your NHS GP is to get more than TSH done. So a TSH doesn't really mean that much. What we need to be seeing is your T4, your T3 and your thyroid antibodies. Those are the really big, and not just one thyroid antibody. It's both thyroid antibodies. So I don't know what your experience is with, but over here we only treat EPAs. We need thyroglobulin as well. So that's the best first step for those who can't, is actually get those proper tests done. And they can see, because sometimes I have patients who have a completely normal TSH, and yet you do their T4, their T3, and they are not only suboptimal, but they're completely abnormal. And they've been sat there with this TSH of 0.8 or whatever, and nothing's been done. So that's the first thing that they can do. And I don't go on them myself because I stay well away from forums, but I know that then if they post those up on the forums, there will be people around who can help them and give them advice who've gone through the same process themselves. I also always tell all of my patients to go on, get their vitamin D levels checked to see if they need some vitamin D supplementation, zinc and selenium. They're the sometimes magnesium as well. Those are the very basic things that your thyroid needs for optimal thyroid health. And sometimes that's all you need.
Exactly, and this is because again, because I see comments, we won't be answering probably all of them because it will be quite a lot of questions, but I'm monitoring them. So someone obviously said that, you know, there are other ways than medication, and of course, I think we both here are 100% on the same page. There is so much, especially with Hashimoto's, that you can do, addressing, especially lifestyle, actually your nervous system, vitamins, nutrients that are missing, and only then, you know, you must investigate further, and then perhaps medication or change medication would be an option. But I just want to stress that no one here is saying that this is like the replacement, right? You still need to make sure that your nutrients are in check before you decide to just go. Because I've got clients who, you know, like completely disregard when they come to me, completely disregard the basics of healthy living and nutrition, and then they surprised they still have symptoms. Well, for me, this is like a non-brainer.
Yeah, and you know, there is the phrase "you are what you eat," and that's ultimately true. If you eat terribly, I'm really sorry. I've got people in the background.
Don't worry, I always have cats here that are jumping all over the place.
This is going live on Instagram. Off we go.
Right. What did I want to ask you next? So we've chatted about, obviously, again, without going to too much detail, because again, another huge subject, but NDT and T3. Perhaps you can just, because not everyone understands what that exactly, you know, what it is, when to use it. Maybe you can do like a bit of an intro to the whole subject.
I just want to go. I want to go back to what you were saying about the there are other ways, and of course there are other ways. And I think that the fundamental thing is I'm a doctor, and that's I'm going to be looking at the medications, the joys of live OG, absolutely. The prescriptions, you know, this is why we've got you guys to look at the nutrition. Nutrition is not what we are taught in, but obviously it's about being as healthy as you can. And we do talk about diet and lifestyle a lot, but it's not my specialism. So NDT and T3, when do you need to go on that? So generally, my patients who are sat there with having been on levothyroxine for 20 years and felt crap on it, generally we find them and we have TSH, which is completely fine because they've been on treatment, T4 that's high, whatever, and a T3 that we look at that and we go, God, the ratio of your T4 to T3 is shocking. And there are ways that you can optimize that. So diet, supplements, ashwagandha, vitamin, zinc, selenium, vitamin D, all of that might help that conversion of the T4 to T3. And sometimes we'll go, do you know what, let's give that a go for 6 months. It's the cheap way of doing it. However, there are some patients it just is not enough on, and I'm now one of those. And at that point, it's getting you onto some sort of T3. As I always put, we need a T3 boost here. And the choice of NDT and T3 is very dependent on your background, the costs, and what you decide to do, really. But the biggest thing is the conversion. That word I use so many times a day. It's the conversion of the T4 to T3. And I have a analogy that I use of a steam train. So a steam train is your body. The driver, the man that's putting all the coal in, is like your brain, the thing that's driving the train. Your thyroid, your body is like the fire. Your BMR is the fire. The T4 is the coal that goes on, and that's your fuel. Okay, and we can keep putting fuel in, but if there's ultimately no fire to convert that into steam, which is the T3, your body isn't going to function. And actually, one of the things, so it's that conversion. So all the enzymes, everything that needs to be converting from the T4 to the T3. If that isn't working, we're going to have more interruption. If that is converting,
this is just making this whole interview. No one will listen to you or me. Everyone will be just focused on what's happening in the background.
Oh God, we're all used to it, aren't we, with COVID? Then your steam train isn't going to go. So if you've got no steam, your steam isn't going to go. And actually, the other thing that is really interesting is more than that, is that actually if you keep piling fuel on top, like any fire, keep putting more fuel on the fire, it will go out. And that's the case with T4. So actually, the more T4 sometimes that we give, the more likely that your body is to create reverse T3 and not the T3 that we need.
I love that. I love that analogy. It's because I also obviously talk about conversion all the time, but it's such a perfect way to describe it, especially with this almost like T4 loading where your body can't process it, which can even make the problem worse. So that's fantastic. So then you'd consider supplementation, obviously working on conversion, but then comes the point where you would include some sort of either a natural or a synthetic T3. And then what happens? Usually you see that most people feel better, or is it like a quite individual thing?
I would say 90% of my patients on NDT or T3, even more possibly, feel so much better.
Okay, and no, because I agree. Most of the people that I see around it also like love it, and they'll never stop. But I've seen a few, including my mum, funny enough, who felt like kind of slightly agitated and really activated on it. Is that something that can happen, or is there a way to manage it potentially?
So often, so there's a couple of things with that. So initially, when you introduce T3, especially if people have got very low T3s in the first place, you need to introduce it very slowly, because so triangle of hormones, okay, I talk about so often: stress hormones, thyroid hormones, sex hormones, female hormones in most of the cases, but sex hormones, so estrogen, progesterone, testosterone. I'm going to ignore the sex hormones for the moment, but cortisol and thyroid are so interlinked, and everybody who's read loads of books about thyroid, there's always talk about the thyroid.
It's one of the biggies.
One of the big three. And with adding in T3, often what we find is that boosts cortisol, and sometimes that can be temporary, and it will settle within 1 to 2 weeks of taking it, and you almost have to say, okay, do you know what, you're going to have a crap couple of weeks, but go with it, and we'll build up very, very, very slowly. Sometimes it just doesn't settle, and people don't like it at all. With elderly people, so going back to your mum, often I find that they struggle with it even more. And so it's a case of really building up very, very, very probably because they just haven't had much T3 going around in their system for so long. It's a bit of a shock to their system.
Yeah. And I think I don't know if I told you that, but I think this is exactly what happened with my mum. I think you spot on the money. There was this huge dosage that was suddenly introduced. And I think this is particularly important, to go and see someone like yourself who uses it and is so known to, so used to using it every day, because it can cause a little bit of a reaction. And I know there is a way that you can request T3 from like your general GP. I think it's something like named patient basis.
Named patients,
But then I'm thinking, is that going to be a good idea if they don't prescribe that like on everyday basis? So it's so I think like seeing someone like yourself, I think that is even the added advantage. But in terms of the cost, because I know that quite a few other people watching would be probably wondering, and without giving like concrete numbers, but what's the average kind of cost that people would be looking at?
So I generally will say it's about 80 to 120 pounds a month.
Okay.
80 to 120 pounds a month seems to be about the average T3 NDT cost. Yeah. But that's it's all very dosage dependent. It's all very brand dependent. I mean, there's a whole other ball game of, some people don't like various different types of levothyroxine. Some people don't like different types of NDT. Same with T3. So I'm sure as some of your viewers, I don't know if any of them are on T3 and are on thybon-henning, but we currently have a massive lack of thybon-henning in the country because they've been licensed. Now, because they've brought in a licensed T3, thybon-henning is much cheaper than any other T3. So if we get you thybon-henning, it's much cheaper. If we're getting you on the licensed, it's unbelievably expensive.
And this is incredibly frustrating, and I know that a lot of people just won't be able to afford that, which is a shame. But I think what we must stress is that is like another course of action before you try everything else. And from my experience, I see that lots of people I work with, they haven't tried the other interventions. They haven't tried working on diet and lifestyle, even looking at their, just changing their dosage, even levothyroxine dosage, how you take it.
Absolutely.
So I think this is, there is also working with yourself and your consultations is not just about prescribing T3. There is so much else that we can.
I would say probably of my caseload, we have about a third who are on levothyroxine, on levothyroxine and supplements, probably a third are about on NDT, and about a third who are on a T4, T3 mix, and a few who are on T3 only. What was I going to say about levothyroxine? I think for me, the biggest thing, and actually I saw it on your Instagram as I was trying to desperately get onto the link. I was flicking through your Instagram seeing if I was missing something. I saw one of your things about I think you'd put normal and optimal in your thyroid, and I thought that's exactly it. It comes back to actually it's finding your optimal. Now, we don't know what your and my optimal thyroid hormones were before we had Hashimoto's. And we're all guessing are you coming back? Are you going back? We're then almost guessing what it is that you need. So I have some patients who, for example, are actually feeling tired, fatigued, whatever, and actually they're completely overtreated. and
Okay.
I've just reduced their levothyroxine and go, well, this is optimal for you. Fine, that's when you feel good. I had a lady today who sits with a TSH that's really high, a T3 that's around sort of 4.5. GP panics because the TSH is really high, but that's where she feels good, and that's okay.
Yeah.
So it's what is normal for you, what do you feel optimal on, and not just going, well, that's in our normal ranges. That's, for me, the biggest message is optimization.
100%, and listening to your own body, isn't it? Because it's not about where that TSH falls, it's how you feel when you're taking that particular dosage, and this is to do with anything we do, like any experiments we run on ourselves, you know, whether it's medication or lifestyle or diet. We need to be so in tune with what's happening, because it's like this is our best course of action. Our body will really tell us what's happening. But I think that's that's a fantastic point. There is a question here about T4 and T3 combination medication, as in one pill. Is that available, like a combo?
So it is. I don't use it very often. But yes, it is. I think it's very expensive, which is why I don't use it often, and it has to be formulated specially.
Oh, like a compound. Okay, all right. Yeah. What else did I was? Let's see the time, because I don't wanna. We'll be wrapping up probably soon. But just before we wrap up, how are you looking for time? You're good. Just in terms of Hashimoto's, obviously, do you recommend testing that everyone? Because that's my general advice to anyone I work with. I always say you should know what you're dealing with. If you're hypothyroid, so it's always advisable. And obviously, there is a lot we can do with nutrition and lifestyle and all sorts of like healing protocols. From your standpoint as a GP, what are your interventions? What do you offer when someone comes in, tests for antibodies, both come back really high? You know, what's the course of action then?
I missed the start of the question because I got a notification through. So say, what was the start of your question?
So that someone comes in with hypothyroidism, and then you test for antibodies.
To the thyroid clinic or me as a GP?
To your private, your private clinic.
Go on, so carry on. If somebody comes in with that.
So in terms of your, so what is, because obviously I know what I do for Hashimoto's clients. It's obviously there is a, we know what to do for an autoimmune, condition present. But in terms of the actual medication or your advice, what is the benefit there? Because officially there is no, medication or cure, right? But there are other things that you can do, right? So what would that be if someone is like high on antibodies, let's say like 500 plus 1,000?
So what do we do for the antibodies is basically what you're saying. So I think that's an interesting question, antibodies, and it's a question that patients often ask, and the verdict is slightly out. And if we talk to various different people, you're going to get a very different answer. So again, it comes back to lifestyle, it comes back to diet, it comes back to exercise, it comes back to putting in what you are, what you eat. However, I think there is no cure for Hashimoto's, in my opinion. And I know that isn't everybody's opinion, and you can all have whatever thoughts you want to have about that. But I don't think that you can fundamentally cure a Hashimoto's. You can improve it. You can bring down your antibodies. You can bring down, you can even make your antibodies normal. And I have seen that in lots of people. And I know that, I know that you have. Yeah, exactly. And I think that diet has a big effect on that, but I have to say also that so does proper treatment, proper hormonal treatment will have a huge effect on them. And what we know is that hormonal treatment actually prevents, it slows down the progression of Hashimoto's. So it's all of the stuff we talked about, isn't it? So it's lifestyle, it's diet, it's some people find going gluten-free really helps for them, helps with their symptoms, helps with flare-ups. Probiotics can help because it helps, the gut. Dairy-free, some people as well tend to like and find that they feel better on, and it brings the antibodies down. Another one that I've started to really use is LDN. I don't know if you
I was about to ask. So you do, because it's quite that is a little bit more affordable, isn't it, in terms of the cost of treatment?
And LDN seems to suit certain types of people, certain groups of Hashimoto's, and it's really I have a few who are on it, and it's making a real difference to them. As yet, I've only just really started to use it, so I haven't seen the effects that it's had on the antibody numbers themselves. So it's an interesting one. There are things, and people often say, why can't we treat the underlying problem? And if the type of drugs, and remember again, I'm this is what I deal with, is drugs rather than anything else. The type of drugs that we have that were to treat an autoimmune are far worse than the Hashimoto's itself. If the Hashimoto's is properly treated, and that's a big caveat, as long as the Hashimoto's is optimally treated.
No, I 100% agree. I think, I think, like, knowledge is power here. So the moment we know that we are dealing with an actual autoimmune condition, that can just changes completely how we approach the subject, right? Because there is one thing about optimizing your thyroid, then addressing the autoimmunity is another thing. And 100% everything that you've mentioned. And that's, like you said, some people have different triggers. That's why I don't really believe in and we've chatted about it before, like we're on the same page with like removing everything from your diet forever. If anything, that creates nutrient deficiencies that will slow down your thyroid.
Well, and stress.
Stress,
which is worse than the gluten itself.
I agree. All righty. So what would be the one, you probably already said like at least 10 super useful things, but the one thing, if someone joined now and there is one thing they would leave with, what would you say to them? Something that they can like do.
So I think asking your GP to do proper blood tests, TSH, T4, T3, that's a really good start. I think selenium, zinc, vitamin D as optimal nutrients, really basic, simple ones that you can do. And I think optimization is the key. Normal isn't normal for everybody.
I agree. Amazing. So now tell us how can people work with you? How can they find you? I'm going to pop your details onto my page as well, just so everyone's got the details. But what's the waiting? Because I know we've got a bit of a waiting list now.
We're probably looking at about 8 to 10 weeks waiting list to get to see me for an initial consultation at the moment. I keep adding hours and I keep getting booked up. So, and to be honest, I've got kids and things, so I need to see them. But I think just email. So go to my website, which is the Thyroid Clinic UK. Email me in or book directly on the website. I have a fantastic PA who has literally saved my life these days, who will help with everything that you could possibly need. We have blood tests, so that's the other thing. If you're finding that you can't get your GP to do some blood tests, I now have blood tests that we can do either with finger prick, or you can go and arrange to take your blood, and I will look at them. I obviously won't be able to look at them in the context of all your health, but at least I'll be able to look at them with a thyroid expert view. If you're even just curious whether you've got it or not. So I do those as cheaply as I possibly can. That's the way to get hold of me. And a bit of patience, and know that if you get booked in, that I do get cancellations, so I can always.
Okay, that's good to know. And it's all online, right? So you, like me, you've also moved everything online, which is great.
Because I set up in the middle of lockdown, I had to do it online, and so everything is as user-friendly as possible. I mean, literally, it's not always necessarily good for us thyroid patients to be sitting on our asses all day, but it is set up so you can literally sit on your bum. Everything will be sent. Everything should be sent over to you that you need. So we can send over blood kits, we get all your prescriptions online, all of that online. I do face-to-faces, but they have to be booked in specially because I have to book.
Okay. Fantastic. Well, thank you so much for joining us today, Georgina, and thank you for all the amazing work that you do.
It's my pleasure.
And hopefully I can have you back here, and we're going to maybe chat about HRT.
HRT. Yeah, HRT is the biggie, isn't it, at the moment?
It's huge.
Wide.
Anyway, thank you so much again. Have an amazing rest of your day, and I'll chat to you soon.
Pleasure. Will do. Take care, everybody. Thanks.
Bye.
Bye. Bye.